With that, I'd like to invite our founding director, Dr. Haile Debas, whom many of you know. Dr. Haile Debas is former Dean of the School of Medicine, Chancellor Emeritus at UC San Francisco, and he's contributed extensively to global surgery and medical education, leading initiatives to strengthen surgical care in low-resource settings. We're all gathered here because Haile was the very first spark for IGHS. He brought the vision to establish the Institute. He brought the vision that led to advancing health worldwide as our tagline. You're about to hear from him about the Institute's founding, some of its history, and later in a video address from Bill Gates. And I'd like to welcome him to the stage.
Good morning. Thank you very much for coming. Chancellor Hogwood, Dr. Nahid, Global Health Sciences, family and friends. You cannot imagine how proud and happy I am to be part of this celebration. Let me start by welcoming Dr. Mamphela Ramphele, here as President. She is here as Presidential Chair, visiting professor. Formerly, she was Vice Chancellor of the University of Cape Town. She is also the founder of the Agang South Africa political party. And in 2007, she was awarded the UCSF medal, which is our equivalent to the honorary degree. She visited us some 20 years ago when IGHS was still in its infancy, and she is returning now to see how we did it. Welcome, Mamphela. In June 2003, I suggested to then Chancellor Bishop that we should develop a UCSF-wide program of global health. Mike was not only enthusiastic, but he also rapidly allocated startup and operating funds, and UCSF Global Health Sciences was born. Thank you, Mike. We're all very grateful to you. I would also like to express my deep gratitude and admiration to Richard Feacham, Jaime Sepulveda, George Rutherford, Payam Nahid, who have led IGHS as executive directors and brought about its remarkable growth and accomplishments. Thank you very much. Numerous people have contributed to the creation and development of the UCSF Institute of Global Health Sciences. At the risk of leaving out some people, I have listed on the slide a few. I have listed on the slide a few of the key individuals, but truly the number of faculty, students, and staff is so large, it's not possible to list them all. I want especially to recognize Sarah McFarlane of Liverpool, who was unable to be here today. She was the first faculty recruit. Her extensive public health knowledge and wide networking ability, particularly in Africa and Asia, were key to IGHS's early rapid development. As the founding director of the UCSF Institute of Global Health Sciences, I'd like to express my deep gratitude to all of you. IGHS is a legacy of which we can all be proud. The beginning of the 21st century was like no other time. Students, residents, and young faculty members all over the Western world became enthusiastic about global health, much as they were in the Peace Corps movement during President Kennedy's tenure. Whenever there was a global tragedy anywhere in the world, it was these young people who were the first respondents. They are optimistic and inspiring. It is because of the enthusiasm of students and trainees that universities across the country started to develop global health centers. UCSF was the first, and according to Michael Merson of Duke, as reported in the New England Journal of Medicine, our institute was the first academic global health center in the country. In its 25-year history, IGHS has made two structurally notable contributions to global health, locally and internationally. First, in collaboration with Gerald Koch of Boston University, the late Tachi Yamada, and Jaime Sepulveda, both of whom from the Gates Foundation at the time, UCSF IGHS established the Consortium of Universities for Global Health, CUGH, with generous funding from the Melinda Gates Foundation and the Rockefeller Foundation. Not a minor feat, I think you'll agree. Now CUGHS is an organization of 190 academic institutions from all continents, and its annual meeting is attended by close to 2,000 people from all over the world. Once fully established, CUGH was then moved from UCSF to Washington, where it now resides. Second, the 10-campus University of California Institute for Global Health, UCGHI, now led by our own Madhavi Dandu and previously by Tom Coates, was also developed within UCSF IGHS. UCGHI then partnered with all the 10 campuses to strengthen global health throughout the University of California. Locally, UCSF IGHS also helped develop and launch the Bay Area Global Health Alliance, which brings together the academic centers in Northern California and biotechnology and the donor community. In education, thanks to the dedication of John Ziegler and Karen Nelson, UCSF launched the first master's program in global health and followed this by developing a PhD program now led by Elizabeth Fair. IGHS has valued strong academic partnerships locally, nationally, internationally. Its partnership with the UCSF professional schools has been a win-win experience for all of us. Our institute was named Global Health Sciences to indicate the importance we place on science in our work and in our partnership with the basic science departments. From the beginning, the basic science community has been most supportive, and I want to thank their faculty as well as their trainees for their help. On the international level, early on, we partnered with several academic institutions in Tanzania, Uganda, and the Aga Khan University, which is in Pakistan, East Africa, and London. Let me mention a few impactful outcomes from these partnerships. A major Muhimbili priority at the time was the quality of undergraduate teaching and learning in Tanzania. We were given a major grant from the Bill and Melinda Gates Foundation to undertake an effort to improve this. We worked closely with the MUHAS faculty to revise Muhimbili's undergraduate programs, to emphasize small group teaching, a critical thinking, lifelong learning, and interprofessional learning and teaching. MUHAS also established a residency training program in emergency medicine, as well as the pre-hospital emergency care system, first in Tanzania. I believe trauma care in Tanzania has improved as a result of this. In Kenya, the UCSF Family Medicine Department provided faculty leadership and faculty to enable the Aga Khan University to start a residency program in family medicine. In Uganda, Daruk Ogzedes from surgery and Michael Lipnick from anesthesia have nurtured their teaching programs in anesthesia and surgery for over 2 decades. Finally, the UCSF Board Center of Regenerative Medicine and Stem Cell Research helped the Aga Khan University to develop a sister center in Karachi. In almost all cases, the work of these collaborations was based on the priorities of our partners, but they proved mutually beneficial to UCSF. Over the years, we have been fortunate to have internationally recognized leaders, including Sir Richard Feacham, Jaime Sepulveda, George Rutherford, Ambassador Eric Gusby, Payan Nahid. They led all of the progress IGHS has made, with much of the growth occurring under Jaime Sepulveda's leadership. We have grown from a total 5 faculty and staff 25 years ago to over 300 today. Similarly, annual expenditure has grown from about 8 million to about 100 million. As the founding director of IGHS, I extend my deep gratitude to all of you who have helped create a legacy we can all cherish. We have entered a difficult period in U.S. global health history. It is most unfortunate that our government has dismantled much of the country's global and public health apparatus and the funding and the federal funding mechanisms. But I am optimistic that things will change. And I'm very encouraged when I see Dr. Nahid's determination to actively grow the future of global health. My own hope has always been that IGHS and other relevant UCSF programs in public health will merge to form the UCSF School of Global Health, of Global and Population Health sometime in the future. I hope the Chancellor is still here to hear that. We must remember we have regental approval to open a 5th school. I don't know if a 5th school will ever be a reality, but I hope it will remain under consideration. Let me close then by expressing again my deep gratitude to Chancellor Hoggood for his continuous support of IGHS, and to all of you who have made IGHS what it is today. And thank you for attending the 25th anniversary. Now I would like to share a few words from our friend Bill Gates.
Good morning. It's an honor to help celebrate the 25th anniversary of the Institute for Global Health Sciences. I remember sitting down with Haile Debas and Tachi Yamada to define what the term global health really meant. The result of those discussions was a vision, a future where science and medicine were leveraged to save the lives of the world's most vulnerable people. 25 years later, it's inspiring to see how that vision lives on here at IGHS. I've always admired the Institute's ability to bridge disciplines, connect communities, and keep pushing for bold breakthroughs. Over the years, the Gates Foundation has been a proud partner with IGHS on the fight against malaria, HIV, and neglected tropical diseases. Many from the Gates Foundation have gone on to work at IGHS. And it's amazing to see how your leadership has grown and expanded the work over the years. The progress you've enabled is remarkable. Child mortality has been cut in half. New vaccines and treatments are saving millions of lives. Advances in technology have transformed how we diagnose, prevent, and treat many diseases. The future holds even more promise as long as we keep investing in innovation and delivery. All of you know how incredible the ROI is for global health spending. Every dollar spent on global health R&D keeps families healthy, grows local economies, and strengthens global stability. That's why gatherings like this matter so much. Together with your ideas, passion, and leadership, we can build on the last 25 years and chart the next generation of breakthroughs. Congratulations again, and thank you.
Thank you, Bill Gates. You're really the inspiration for all of us. And thank you for all the help you've given UCSF Global Health Science over the years, and also for standing up during this difficult time for science. Thank you.
Dear Haile, thank you for reviewing our history so comprehensively. It was not an easy task to summarize 25 years, but you managed. There's another individual who has been here from the very beginning. As you as our founding director and me as the current director, it's appropriate to recognize this individual. And we'd like to just thank Robert Mansfield for... for 25 years of service to IGHS. Let's get a photo of that. Thank you, Robert.